should my dad with chronic hypoxemic respiratory failure, tracheostomy, and history of necrotizing pneumonia with ongoing concerns for right-sided pneumothorax go to LTAC instead of staying in ICU? That's the question I'm going to answer today. And let's look at it in much detail now. My name is Patrick Hutzel from intensivecare.hotline.com, and I have another quick tip for families in intensive care. So currently we're working with a client and member who has their father in ICU and has been having their father in ICU for quite some time now with chronic hypoxemic respiratory failure, has a tracheostomy, is ventilated, and has a history of necrotizing pneumonia with ongoing right-sided pneumothorax. So clearly, nobody should be going to LTAC or on a ventilator with a tracheostomy. And the reasons for that is that, you know, when clients go from ICU or critical care into LTAC, and for those of you that don't know what LTACs mean, LTAC stands for long-term acute care hospitals. And this is basically only happening in the US. You know, many patients in intensive care on a ventilator with a tracheostomy and a PEG tube are being pushed out from ICU to LTAC. And it's a massive system failure. The reason I'm saying that is, you know, we have literally clients coming and families coming to us and asking them to help us to get them out of LTAC. They're literally begging us because the system is so bad. The LTACs are so bad. Because LTACs, quite frankly, are a scam. As a matter of fact, I've made a video about it a while ago, 10 reasons why LTACs in the US are a scam. And I encourage you to look at the online reviews of LTACs, any LTAC around the US, and they're not good. People are dying in LTACs. It's a complete system failure. So, and also, you know, when it comes to necrotizing pneumonia, I mean, that needs specialized care, which patients in LTAC simply don't get. You know, with necrotizing LTAC, pneumonia and also ongoing pneumothoraxes, you know, that needs, you know, specialized medical and nursing care, which simply is not available in LTACs, right? Another thing that is happening with this particular member is, you know, that the hospital is trying to impose a DNR order, a do not resuscitate order for this particular patient. And, you know, we obviously have advised the family how to, you know, that they shouldn't sign for a DNR order. It's completely inappropriate. You know, it's actually up to the family and not to the hospital when a patient, you know, should be made DNR, and there's no wish from the family or the patient to have a DNR. So, you know, but they're also trying to create that narrative that, you know, with the DNR, it's easier to send them to LTAC. And like I said, many patients have died in LTAC because they don't get the same level of care than they get in ICU. And very few LTACs have the specialized skill to wean patients off ventilation and tracheostomy. Also, sodium levels are below normal for this particular patient. And again, that needs to be corrected first. And the best place to wean a patient off the ventilator and the tracheostomy is actually in ICU, not in LTAC. Furthermore, this particular patient has not had any spontaneous breathing trials because he's hemodynamically too unstable and secretions are copious at the moment. So that all of that needs to improve before spontaneous breathing trials and ventilation weaning can even commence. Especially with necrotizing pneumonia, you know, which is sometimes can show up in with a large abscess, empyema, and necrotic cavities. You know, it needs percutaneous drainage, might need surgical debridement, or even a lobectomy or segmentectomy, which means that parts of the lungs need to be removed, right? So certainly those are not cases for LTACs, you know, because in those situations, patients can also rapidly clinically deteriorate. They can bleed massively and they can go into multi-organ failure. And like I said earlier, there's a huge risk, a much higher risk for pneumothoraxes. So for your dad to go to LTAC, you know, he could only go if the LTAC was offering the same level of care and treatment than an ICU can, which they can't. So, you know, how do you keep your dad in LTAC? Well, simply by advocating for him and following our advice, of course, but also no ICU can discharge your dad without your dad's consent, or if your dad can't make decisions without, you know, power of attorney consent. In your case, that's you, you know, don't let anyone force you. No one can force you to go to LTAC if there are clinical reasons not to go, and there are plenty of clinical reasons. And so far, I know you've stood your ground anyway, but I also want to share with our viewers here that, you know, you have every reason to keep your family member in ICU instead of going to LTAC if they're ventilated tracheostomy dependent, if there's multiple complications, you know, multiple things that still need to be sorted, because you won't get that specialized nursing and medical treatment in an LTAC. Simply not happening, right? And things will deteriorate very quickly, and don't put your loved one in that situation, right? We have helped so many families to keep their loved ones in ICU, get their issues sorted there instead of going to LTAC. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and I've been consulting and advocating for families in intensive care since 2013 here at intensivecare.com, and I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that by looking at our testimonial section at intensivecare.com, and you can verify that on our intensivecare.com podcast section, where we have done client interviews, because our advice is absolutely life-changing, right? The advice and advocacy that we're providing is so life-changing that, like I said, we have saved many lives, and we're improving the lives of our clients and our members instantly, so that they can make informed decisions, have peace of mind, control, power and influence, making sure their loved ones get best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, once again, to improve their lives instantly, making sure they can make informed decisions, have peace of mind, control, power and influence, making sure their loved ones get best care and treatment always. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to you and your families directly, I also talk to doctors and nurses directly. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I talk to doctors and nurses directly, either one-on-one, or I have you on the phone with them, or I'll set you up with the right questions to ask. I also represent you in family meetings with intensive care teams, so that you can have clinical advocacy and representation on the family meetings with intensive care teams. We also do medical record reviews in real time, so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecare.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that, once again, will help you to improve your life instantly, so that you make informed decisions, have peace of mind, control, power and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecare.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecare.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. click the like button, click the notification bell, share the video with your friends and families, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on the show, and you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you're a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.